I have nominated the Bennion Centre after their amazingly successful year being accredited by the Royal College of Psychiatrists. They have gone over and above to continue to improve the quality of care and experience for patients, carers and the staff on both of the wards there, to improve clinical outcomes by introducing initiatives such as drama therapy, wellbeing clinics and enhancing the discharge process.
I first had the pleasure of meeting Norman when he was a preceptee, so he was a newly qualified staff nurse to the organisation, and I had the invite to go and shadow him on his caseload. He's a district nurse, and I went to shadow him for a clinical shift for the morning, and Norman explained to me that this was his second career choice, and immediately put me at ease because I hadn't been out with the district nurses before. I was also new to the organisation, and I felt Norman was really quite passionate about nursing right from his discussion with me around why he wanted to do nursing, why he'd come into nursing. And then when we went to visit the clients, the first client that we went to visit was an elderly gentleman who was a real character and not really adhering to his insulin regime. But Norman was very professional, very good at motivational interviewing actually. I was very impressed with the way that he assessed this client. He was actually quite a tricky client, to be fair. Norman managed to persuade him to have his insulin. He also did some health promotion advice with clients, and clearly had a very good rapport with this individual.
I nominated the respiratory specialist team because of their outstanding contribution to working with technology. We have been using a telehealth project within the team for some time now, which is whereby patients with COPD receive a tablet with lifestyle questionnaires and symptom questionnaires. Patients are asked to submit how they're feeling and what their baseline parameters are doing. This helps the team to identify if the patients are experiencing exacerbation, and then they can make appropriate clinical contact.
Ben works as a support worker for the Assertive Outreach team. He is admired by patients and team members. They appreciate him for his sincerity, hard work, and also his very positive nature. He has also taken many opportunities to develop his own skills in phlebotomy, ECG, and other checks so that patients can have these checks that they would normally refuse. This has really helped us to improve the physical health care of patients with severe mental illness.
I have nominated the Bennion Centre after their amazingly successful year being accredited by the Royal College of Psychiatrists. They have gone over and above to continue to improve the quality of care and experience for patients, carers and the staff on both of the wards there, to improve clinical outcomes by introducing initiatives such as drama therapy, wellbeing clinics and enhancing the discharge process. We are delighted to be part of this quality network going forward to continue to share our amazing good practice but also learn from others in the future.